Greetings and welcome to Ask Dr. Danett, where I answer one women's health question from an Eastern medicine perspective. Today's question is, why do I feel more sad in winter and what can I do to help? Well, as living beings, we are intimately connected to the environment. It's important to remember that what happens in nature also can happen within us. In Eastern medicine, this way of understanding health, that we live in relationship with the seasons and with the sun, applies throughout the entire year. We are always responding to light, to temperature, and to seasonal shifts. Winter is definitely one of those seasons, and it brings specific changes that can influence our mood and energy. This understanding that our health, mood, and energy are influenced by the seasons and by light has been a core part of Eastern medicine for thousands of years. It's important to remember that we are naturally affected by the sun, by light, and by darkness. There's a reason why we associate sunshine with happiness. It connects with something deep inside of us. So when winter arrives and there's less sunlight, it can absolutely affect our mood and our emotional well-being. Sometimes this seasonal low mood is referred to as seasonal affective disorder or SAD. And sometimes it's simply a seasonal pattern, not a diagnosis, although that is all within the constructs of Western medicine, and I'm strictly from Eastern medicine. Women in perimenopause and menopause, very important to remember, do appear at a higher risk for low mood during the winter months. Seasonal changes can worsen symptoms of depression or seasonal affective disorder, particularly during this phase of life. Hormonal fluctuations during perimenopause and the drop in estrogen around menopause affect serotonin, which is a key neurotransmitter involved in mood regulation. This can make women more vulnerable to mood changes and depression. Shorter winter days means less exposure to natural light, which can further lower serotonin and disrupt our circadian rhythm and melatonin, both of which are closely linked to seasonal low mood and SAD. Some women in early or late menopause already have a higher baseline risk for depression, and winter-related factors such as less light, more isolation, and increased stress can amplify those symptoms. In practice, women in perimenopause or menopause often report mood swings, irritability, anxiety, fatigue, low motivation. During the winter months, these symptoms may become more intense and/or more frequent. Clinicians and menopause-focused resources often describe winter as amplifying menopause-related mood symptoms, creating a kind of perfect storm for seasonal depression or significant winter blues. I want to pause here and say that if you notice low mood most days, it goes on for more than 2 weeks, especially if it happens every winter, or if you notice a loss of interest in activities that you usually enjoy, marked fatigue, or very significant changes in sleep or appetite, or if you experience thoughts of hopelessness or self-harm, please consider reaching out to a qualified health care provider, such as your primary care clinician, gynecologist, or a mental health professional. The suggestions that I'm sharing today do not replace the guidance of your personal clinician. There are also gentle supportive practices that can help support emotional well-being during the winter months. So first, consider going to bed a little earlier. Winter, again, is about following the sun. When the sun goes down earlier, it's supportive for us to do the same. From an Eastern medicine perspective, winter is a time of restoration And nothing restores the body like a good night's sleep. Going to bed earlier also makes it more likely that you'll be awake during daylight hours, which can help to support mood and emotional balance. Second, prioritize light and fresh air. Even brief time outdoors during the day can really make a meaningful difference. When possible, step outside during daylight hours or do your work near a window so you can receive the benefits of natural light. Third, stay connected to others. Winter can be isolating. We may see neighbors less, socialize less, and naturally turn inward. And while winter is a time for reflection, we still need connection. Phone calls, FaceTime, and staying in touch with people we care about can help protect emotional well-being and reduce isolation. It makes sense that winter draws us inward. It's important to make space for quiet moments, journaling, reflection, and very, very importantly, rest. And it's also important to remember spring returns, light returns, more energy returns. When we work with the seasons rather than against them, winter can become a time of restoration rather than struggle. I often create educational resources to support emotional well-being and seasonal patterns from an Eastern medicine perspective, so you can always check the description below for updates or future resources. And if you'd like your question answered in a future Ask Dr. Danett, you can submit it using the link below. As always, take good care, and until next time, love being a woman.